Hey everyone! Welcome back to Addictopydia, the channel where we break down everything you need to know about addiction and recovery. Today, we're diving into the science behind addiction, why it's not a weakness or moral failing, and how understanding it can literally save lives. Let's get started. Let's clear up a huge myth. Addiction isn't about lack of willpower. Addiction is a chronic brain disease. It actually changes the structure and function of the brain. Nearly 10% of adults in the United States are affected by substance use disorders. Here's what happens in the brain. Addiction swaps your natural desires with cravings for the substance. Over time, things you once enjoyed just don't feel rewarding anymore. Addiction shows itself in three main ways: craving for the substance, loss of control over its use, and continued use even when it causes serious problems in your life. Substances hijack the brain's reward system, which can also lead to physical dependence. When people stop, they may experience unpleasant or even dangerous withdrawal symptoms. And addiction rarely acts alone. Stress, anxiety, trauma, and other mental health disorders often co-occur with substance use. This is called a dual diagnosis. Studies show that about 7.6% of adults have both a substance use disorder and at least one other mental health disorder. So who can develop an addiction? The short answer: anyone. It doesn't matter your age, gender, or background. Several factors can contribute, including genetics, mental health, peer pressure, and life stressors. But how can you tell if someone is struggling? Look for changes in sleep or appetite, weight fluctuations, poor hygiene, extreme mood swings, or withdrawal from friends and activities. Teens are especially vulnerable. Peer pressure, curiosity, and using substances as a coping mechanism can turn into dangerous habits quickly. Now here's the good news. Addiction can be treated. Treatment is personalized, often combining medications, therapy, and support groups. Common approaches include detox, residential programs, outpatient support, and 12-step programs. For those with co-occurring mental health disorders, integrated treatment is the gold standard. Treating addiction and mental health conditions simultaneously is far more effective. Why is relapse common? Addiction changes your brain's reward system, but with treatment, the brain can heal and normal pleasures can return. Recovery is a journey, not a single event. It's about rebuilding your life, repairing relationships, and finding new meaning. Positive behaviors and support make all the difference. So remember, addiction is a brain-based disease, not a moral failing. It affects people from all walks of life, and it can be treated. Awareness, early intervention, and compassionate care make all the difference. If you or someone you love is struggling, reach out for professional help. Recovery is possible, and every step forward counts. Thanks for watching Addictopydia. Don't forget to like, subscribe, and hit that notification bell. Stay strong, stay informed, and we'll see you next time.